Some specific changes that health payers are going to need to consider in response to the legislation are first preparing for the state-run health exchanges, which will be implemented post-2014 and through which most individual consumers will be purchasing their health insurance going forward. A second would be dealing with the increased concentration of providers that they're likely to see in the future and compensating those providers through alternative mechanisms such as the ACOs, accountable care organizations, which are prominently mentioned in the legislation.
Yeah, and I think in addition to reacting to the legislation and the requirements, they really need to be thinking about growth opportunities, both whether those be in other markets, international markets, managed Medicaid for those payers that are not involved in that segment, or those players that are involved, certainly looking at expansion there, given that the legislation is going to drive an increased population in the Medicaid market. And we think actually the shift from the fully insured business to the self-funded business in the group commercial market is a ripe opportunity for payers to think more strategically, I guess, it would be in terms of their pricing. Historically, a lot of payers have looked at that business as kind of a volume business, but not a real source of operating profit. And I think going forward, as the mix shifts, that business is really going to have to stand on its own. So payers are going to have to think about pricing strategically. They're going to have to think about ways in which essentially they can capture more value from that segment. So looking out on the horizon, I think the cost pressure in healthcare is the number one issue really facing payers and their group customers. And those groups are looking for alternatives to help make the cost of care manageable and predictable. And so there's a few ways that they're trying to address these issues. The first is the funding mechanisms, and an example would be the shift to HSA plans. I think HSA plans have almost doubled in the last 2 years, and are up to about the same market share as HMOs. And I don't think anybody would have thought that just a couple of years ago. So groups are essentially looking at different plans. They're always looking at changing the cost shares and different ways of increasing accountability for their members. I think the other area that they're all looking at is wellness and the health of their members, knowing that member behavior essentially drives anywhere from 50 to 75% of the cost of care. They're all looking for a magic bullet in wellness and care management programs. The challenge is they're just not finding it. They're finding it difficult, if you can believe that, to change human behavior. And so you might see some changes going forward.
Yeah. And longer term, there may even be another more fundamental shift that you see in the market as employers are looking to rein in their own healthcare exposure and the expenditures on their employees' health insurance, similar to what you saw back in the 80s when pensions migrated towards 401ks, essentially turning a defined benefit into a defined annual contribution. You may see employers doing the same thing, and you actually are today starting to see some inroads where what are called defined contribution healthcare plans, which go along with a private exchange, are being created, whereby employers decide how much they are going to set aside for each employee for health insurance in a given year, and then the employees are on their own to select usually among a select number of options of health insurance.
And I think what that does for the CFOs of the groups is essentially allow them to say, okay, we're going to spend X dollars on healthcare this year, and we'll spend X dollars next year. So it gives them predictability, but it also puts essentially the full share and the full transparency of the cost onto the member of the group, which is something that's fundamentally lacking in the market today.
And if you look at just about any marketplace, the only way in which costs are going to be reined in are when the consumer has visibility and is responsible for the purchase of the end product, including the pricing. And today, that is clearly healthcare is one industry whereby the transparency of the pricing of the cost and the connection of the consumer to the provider and to the direct payment for services is lacking.